All right, welcome to our weekly meeting slash video chat. Today we're going to be doing the VA versus the Austin Uber and showing the comparisons in how the government manipulates the system in order to make money. So basically what we're going to do is we're going to get started with the VA. All right, now quite frankly, what we do, I have a board here. Yay. With the VA, there are some, we want to look at the problems that the VA faces, or that we face with the VA. The first problem is that you're a healthy individual. As soon as you go in, they check you out from top to bottom. Now, when you get out, you have whatever happened to you while you were in the military becomes pre-existing conditions in which you can't be seen in the civilian market for. You're actually restricted, or your only recourse is to go through the VA. So when you do go to the VA tells you that there's nothing they can do until you get sick. That's their policy. There's no test they can do to determine their liability. So basically that poses the next problem, is that there's no preventative medicine for you. Okay. One of the next problems, if you look and you read my story, you'll see that when I was in Honduras, my mailing address was still Fort Belvoir, Virginia. So when I say something happened in Honduras, or when I say something happened out of that island, they say, well, technically your mailing address is Fort Belvoir, so you never were there. I understand the government's need for secrets, okay? Because I was down there when we didn't admit to having troops down there. But the simple fact is that when you want to deny me medical benefits based off of that technicality, and technicalities are nothing more than words twisted together in order to form a loophole in the truth. So I understand the government's need to keep its secrets. All right. The next thing we run into is that because there's no preventative medicine and because the VA won't see you until you get sick, that means that whatever's wrong with you, or whatever's going to be wrong with you as a result of your service, in which we're exposed to a lot of industrial compounds that place us at an elevated risk for cancers and so on and so forth. But because they wait so long, that they wait until it progresses to a point where you receive a disability rating, and that's the only way that you're going to get medical care. So and that's if you survive the incident, whatever that incident may be. The disability rating actually carries with it a couple of subcategories, because when you receive a disability rating, all of a sudden you have a limited income, you have a limited amount of hours, but also you're going to be on the government dole, because you're then going to draw a government check. We'll just say government check. So, and with preventative medicine, we're also going to put down wait times, because well, that's exactly what it is. You have no preventative medicine and you have a waiting time. Even when you do get approved and you are authorized to see a doctor at the VA, then you have to suffer through those wait times. But you know what? We're going to go ahead and give that its own category. The next thing we have is the budget. And then we have the unethical doctors. Now we could add some more in here, but these are pretty much the key points. You're a healthy individual when you go in the military. When you get out of the military, anything that happens becomes a pre-existing condition. You're exposed to a lot of industrial compounds as well as a number of other agents. The caulk paint on the vehicles, I understand they outsource to paint them, but then guess who gets to do the touch-ups? That's right. The chemical tape we use to identify whether or not we've been in a chemical environment, it in itself is cancerous. People that serve on destroyers, any type of lubricant that's necessary for heavy machinery, it carries high content or high concentration of PCBs, or it used to. Nuclear reactors, one gentleman, he slept right on the other side of it, and now he's got some real issues. So the second thing is that you're not authorized any preventative medicine through the VA. The third thing is that when you go and you try and prove that something happened, you have to face the government secrets. Next, again, when they wait until it goes so far, you get a disability rating, and a disability rating means that you now draw a government check. And with a government check, that actually means that you now have a limited income as well as a limited amount of hours that you can work in many cases. The waiting time, because obviously after you get approved, you now have to wait. A friend of mine, Tony, has waited 21 years for a knee operation now. Every year they send him a letter that says they don't have the resources necessary and that he's not a priority. You have the budget from Congress. Basically, the budget for the VA is for retiring veterans, not for wounded veterans. And then you have the unethical doctors that can actually look at you knowing that something is treatable and sending you out the door. The other aspect, well, when we say that, unethical doctors, because the VA doctors are the one that has to give you the rating or actually make the declaration, the medical opinion that says it's service-connected. For example, when I was down in Montopolis, a gentleman had his face shot off in Afghanistan. The bullet went through the right side of his cheek and out the left side. He did a good job sewing up his cheeks. However, on that day, he was there filing his third appeal in 7 years to get his teeth fixed. The VA continually said his teeth were not service-connected. You know, I'm not sure how that happens, but a doctor is the one that sat there and said, your teeth aren't connected. I'm not sure what he thinks happens when a bullet goes through your jaw. But, so when we talk about unethical doctors, we're talking about doctors that receive a bonus to make a medical opinion that denies you your benefits, just like they call me fat. You know, I'm huge. So anyways, the solution is really quite simple. Basically, when you get out from the military with an honorable discharge, you are allowed to purchase insurance through the VA. You dismantle the VA as a medical facility and restructure it as an insurance company, but as an insurance company in name only, because they're not allowed to sell insurance to anybody else. So with that, there's no insurance agents, no position for insurance agents necessary, sales, marketing, there's very low overhead. All they're going to do as an administrative facility is process claims from veterans and process payments from veterans and process claims to doctors. So basically, in essence, you're going to give us a VA insurance, and obviously you'd have to restructure a couple of things, but with that VA insurance, the first thing that you're going to do, or the first thing that happens, is because the government needs its secrets, there's no pre-existing conditions, all right? And any pre-existing condition that exists when you get out is automatically covered, because it's in that agreement that you make when you enter in the armed forces that anything that happens to you will be covered. And therefore, you don't have to prove it, so the government can keep its secrets. So we've already settled the pre-existing, we've already settled the secrets, and because they can go to any doctor that they want, that takes care of preventative medicine, as well as eliminating the wait time, all right? And seeing as a lot of these things are preventable, like diabetes, it doesn't have to go so far to where you wake up dead one day and somebody brings you around. Um, so that disability rating and the government check, now this is cost effective to the American taxpayer when people don't get on the government dole. And by having the preventative medicine, which prevents that disease from, a lot of diseases are treatable, if it's a colon cancer or certain other types of cancer. So the disability rating doesn't happen because you're able to receive the proper Medicare or appropriate health care. As far as the budget goes, basically, because there's no overhead, you could do it for something nominal like $59 or $69 a month, and that includes, and that's per family member, all right? Because the reason being is that a lot of the stuff that we get exposed to, a lot of the medications that we have to take, the anthrax shot before we went to Saudi, the malaria medication before we went down to Honduras, or while we were in Honduras, or if you ever served in Central America, those have long-term adverse health effects, and a lot of those effects can be passed on to your children, and that's something that your wife is going to have to put up with. So this actually is per person in your family. But the point is that because the veterans are paying into this system, it then becomes self-sufficient, and at least during times of peace. The times that it's not self-sufficient, that it would require federal subsidy, is during a time of war, or during a time of police action, or when the government screwed up and authorized certain products or medications to be fast-tracked. And if you want, and a lot of people look at that and think that sounds kind of like a, anyways, but the fact is that if you look up 3 court cases, you have Dow Jones in 1984 with the Vietnam veterans, the Camp Lejeune incident, and the Aniston versus Monsanto. So it's not a conspiracy theory. That's the word I was looking for. So it's not a conspiracy theory. You actually have court cases in which the government has, at certain times, fast-tracked certain products that prove to be harmful or prove to put you at an elevated risk for cancers. But the point is that it then becomes cost effective for the taxpayers in respect to their budget, because during a time of peace, because veterans are paying into it, it no longer becomes a burden on the American taxpayer. And the last thing is, so the last thing would be that it solves is the unethical doctors. If you've read my story, you can imagine that I ran into a couple of unethical doctors myself, but not to mention the gentleman who had his face shot off. There's a doctor that has to sit there and look at that and say that his teeth are not service connected. So that's kind of one of the biggest things that it eliminates, is the unethical doctors that are acting in whatever capacity they have to in order to misrepresent a patient's health so that they can receive a bonus. So this solves all of these. More importantly is that what we're going to look at now is the example as to why they could possibly do this when it's so cost effective and fair to veterans. So the next thing we're going to look at